Hi friends, good evening and welcome to my channel Mukambika Nursing. Friends, here we are discussing questions for Insurance Medical Service exam, Kerala PSC exam, also for AIIMS NORCET, ESIC, RRB and DSSSB exam. We can discuss the questions. First question, proton pump inhibitors are most effective when given. Options, option A with meals, option B along with H2 receptors, option C half an hour before breakfast, option D after prolonged fasting. Our question is best time for administration of proton pump inhibitors. Example for proton pump inhibitors are omeprazole, pantoprazole, aripiprazole are some examples. So the best time for giving proton pump inhibitor is half an hour before breakfast. Option C is the correct answer. Usually the proton pump inhibitors are given 30 minutes before food intake. Here in our option half an hour before breakfast is there, so that is the correct answer. The next question, an elderly patient present with hypertension and diabetes, proteinuria without renal failure, antihypertensive of choice is. Options, option A furosemide, option B methyl-dopa, option C enalapril, option D propranolol. Our question, an old age patient with hypertension and diabetes, proteinuria without renal failure. Okay, so here what is the antihypertensive drug we can give? Correct answer is option C enalapril. Enalapril is an ACE inhibitors. These ACE inhibitors are the choice of drug for the treatment of hypertension and diabetes with proteinuria. In our question, the patient with hypertension and diabetes, proteinuria without renal failure. So here the antihypertensive drug we can give is enalapril. Option C is the correct answer. Next question, if a pregnant woman has swollen feet, then which activity is forbidden to her? Options, option A lying down, option B no more sitting, option C no standing for long period, option D shoes are forbidden. Here our question, a pregnant woman has swollen foot, that is the foot or feet are swollen, so which activity she should not do here? Okay, correct answer is option C, no standing for long period. Dependent pedal edema is a common complaint during third trimester of pregnancy. This is mainly related to decreased venous return from the extremities. So we should advise her to take frequent rest, elevate the feet and also avoid prolonged standing. Here no standing for long period is there. So that is the correct answer. We have to advise her to take frequent rest, elevate the foot and avoid prolonged standing. And also if edema is present in the face, then hands, then whole body is there, means that also one of the medical emergency. The next question, smoking is contraindicated in pregnancy. Why? Options, option A nicotine cause vasodilation of mother's blood vessels. Option B carbon monoxide bind with hemoglobin and reduces available hemoglobin for fetus. Option C causes dizziness to mother. Option D it is a bad habit. Question, what is the reason for avoiding smoking in pregnancy? Correct answer is option B, carbon monoxide bind with hemoglobin and reduces the available hemoglobin for fetus. During pregnancy, we should advise the pregnant mother to avoid smoking, alcohol, chewing tobacco and also consumption of drug because it may causes intrauterine growth retardation, smaller babies and also there is a chance for abortion. And the next question, for effective fetal blood circulation, nurse should advise the pregnant woman to take rest in options. Option A, supine position. Option B, left lateral position. Option C, right lateral position. Option D, foot and raised position. So our question, which position is more suitable for effective fetal circulation during pregnancy? To avoid supine hypotensive syndrome or vena cava syndrome, we should advise the pregnant woman to take left lateral position. Vena cava syndrome or hypotensive syndrome means sudden fall in blood pressure due to diminished venous return caused by compression of vena cava when the mother, pregnant woman, take a rest in supine position due to the compression of gravid uterus by vena cava. And the next question, which of the following substance does not normally passes through the glomerular capsule? Options, option A, albumin, option B, glucose, option C, urea, option D, sodium ion. Our question is, which substance is normally not crosses through the glomerular capsule? And the correct answer is, it is albumin. Option A is the correct answer. Under normal condition, high molecular substances like plasma proteins include albumin and globulin. This substance usually not passes through the glomerular capsule. And the next question, which of the following technique is correct for the nurse to use when inserting rectal suppository for an adult patient? Options, option A, insert the suppository while the client bears down. Option B, place the client in supine position. Option C, position the suppository along with rectal wall. Option D, none of this. Question, which technique is correct for inserting rectal suppository for an adult patient? Correct answer is option C, position the suppository along the rectal wall. And the next question, what does osmolarity means? Options, option A, total concentration of solute in a solution. Option B, total concentration of solvent. Option C, separate concentration of solute and solvent. Option D, none of this. Osmolarity means total concentration of solute in a solution. Option A is the correct answer. A solution with low osmolarity has fewer solute particles in a solution. Or a solution with high osmolarity have more solute particles in a solution. Okay. Solution low osmolarity means few solute particles. High osmolarity means more solute particles in a solution. And the next question, Moro reflex disappears at which age? Options, option A, 1 to 2 months. Option B, 4 to 6 months. Option C, 6 to 9 months. Option D, 9 to 12 months. Moro reflex disappears at option B, 4 to 6 months. Moro reflex usually disappears by 3 to 4 months. Here 3 to 4 is option is not there. Next option 4 to 6 is there. So that is the correct answer, 4 to 6 months. And the next question, minimum scrubbing time for surgical hand washing is? Options, option A 1 minute, option B 2 minutes, option C 3 minutes, option D 5 minutes. Minimum scrubbing time for surgical hand washing is 5 minutes. Option D is the correct answer. The recommended medical hand washing, this is surgical hand washing, medical hand washing time is at least 20 seconds. Here minimum scrubbing time for surgical hand washing is 5 minutes. And the next question, which drug is used for prophylaxis of manic depressive disorder? Options, option A lithium, option B valproate, option C haloperidol, option D phenytoin. Drug used for prophylaxis of manic depressive disorder is lithium. Option A is the correct answer. And the next question, Which electrolyte has to be maintained in lithium therapy? Options: option A sodium, option B potassium, option C chloride, option D magnesium. Here, therapeutic level of blood lithium is 0.8 to 1.2 milliequivalent per liter, and the prophylactic blood lithium level is 0.6 to 1 milliequivalent per liter, and the toxic level of lithium is greater than 2 milliequivalent per liter. Here our question: which electrolyte has to be maintained in lithium therapy? We should maintain sodium during lithium therapy because there is a chance of lithium toxicity. As a nurse, we should explain the patient that lithium should be taken along with food. Okay, and if there is a symptoms of toxicity, that is nausea, vomiting, excessive vomiting, tremors, twitching occurs for the patient, we should discontinue the medicine, and also we should explain that during the treatment patient should consume adequate water and salt intake. If dehydration may cause, there is a chance of toxicity, so we should explain the patient to maintain adequate fluid, adequate diet and salt intake during lithium therapy. And the next question, highly heat resistant vaccine is option A BCG, option B MMR, option C OPV and option D TT. Question, which is the highly heat resistant vaccine? And the correct answer is it is TT. Most heat resistant vaccine is TT and most heat sensitive vaccine is OPV. And maximum efficiency vaccine is measles. Lifelong immunity vaccine is mumps. And the next question, most common site for central and catheterization is options: option A internal jugular vein, option B femoral vein, option C brachial vein, option C radial vein. Common site for central and catheterization is option A internal jugular vein. Move on to the next and last question in the series, route of administration of rota vaccine is. Options: option A oral, option B IM, option C IV, option D subcutaneous. Administration of rotavirus vaccine is oral. Option A is the correct answer. Rotavirus vaccine is given orally at 6th, 10th and 14th weeks of age. So far we discussed the next set of questions for Insurance Medical Service exam, ESIC, RRB, DSSSB, NHM, CHO exam preparation. So surely these questions will helpful for your exam preparations.